Thank you very much. Marla will join us back at the podium, and we will have time for about 10 minutes worth of questions from the audience. So if you have questions, we have microphones in 2 places. Please line up, and while you're lining up with your questions, I'm going to get started with a couple questions. Both of you talked about how important it is at the local level to really talk to those decision makers. So what I'm interested in knowing, and maybe the group is as well, is can you tell us what some effective messages at the local level would be related to the solutions to obesity?
Well, I can start with that. Do you want to? Okay. Well, I think, again, one of the really important facts that we heard over and over from all the groups that we talked about was how any kind of a policy would impact business in the community. And there were a number of them that actually gave examples of where healthy eating, active living policies helped increase walkability. It increased an avenue for agriculture in terms of a place to sell their products when they developed a farmer's market and such like that. But business was very much on the minds of policymakers as they considered decisions related to healthy eating, active living policy.
Yeah, I definitely agree. Business leaders have the ear of our local politicians. And, I would encourage us, too, to think about the messages going beyond childhood obesity or obesity in general and thinking about the frame of social determinants of health. And so many of our policy solutions fall into the different buckets, from transportation to economic development to food insecurity, that sometimes we need to use messages addressing those considerations to get us to our win-wins. So transportation solutions that build prosperous communities, that help people walk more, that get around, be more active on a regular basis, access to parks, etc. Not being afraid to go and lead with those messages and sharing the benefits from the health lens on the back end.
All right, so another question is, Paula talked about, sorry, you're behind me. I'll stand over here. Paula talked about the State Department being a convener and a collaborative partner to local departments, to local health departments and coalitions. I wonder if you have any case studies or examples you might be able to share with us related to that?
Yeah. We were talking to people at the state level in our key informant groups and at the local level through focus groups. And we heard a lot about the interaction between the role of the state health department and the local health agencies, where the local government has more of the responsibility or authority for, policies related to sidewalks and farmers markets and all that kind of stuff. But what they also told us from the community perspective is how valuable it was to have the state health department involved in that. And that when they had a coalition meeting, how much better the attendance was when there were state health officials in the audience and speaking to that as well. We also heard from legislators and state-level advocates that particularly in states that have large rural areas, that there's a lack of expertise at the local level for helping to devise and design and evaluate the impact of healthy eating, active living policies from the perspective of local government. So that was another reason it was really important to have them in attendance. And also because the state health department was able to provide data. We can not only provide state level data, but also at the state health department can extrapolate that to local level and help in a local community in interpreting that. And another aspect of advocating for policy, or what they learned in observing legislators, is how important it is to have a consistent message so that the local level public health advocates and state level are basically pointing to the same solutions and asking for the same thing. And then also, as you mentioned, Marla, the importance of having those success stories from the field that really impact legislators, be that the city council at the local level, and particularly when a state is looking for considering statewide policy on any of those issues that impact healthy eating, active living. Yep.
All right, so since we don't have any questions from the audience yet, I have another question for you. Considering how important decision makers are and how sometimes it's scary to go and get out of your comfort zone and go and talk to them, maybe there's some intermediary audiences that we could start with as we're getting our sea legs, so to speak, to talk to decision makers. So who could we start with, and what would be those key messages?
So I think it's different for every legislator or administrator, and for the community to really understand who the legislator is. That is the primary target, the primary audience, but the concentric circles of people who influence that legislator. It's really important to really drill in, bring your committee to your coalition together to figure out what is important to that legislator, what committees that legislator or administrator sits on, how they do their work, etc. It could be the business community. It could be the wife. It could be the barber. It could be the kids in the elementary school that go to school with their children. So it's all varied, but it's really understanding who that person is to then translate your key messages to.
What I would agree with that completely, and what I would add to that too is that we also heard that legislators typically aren't looking for any kind of data or information until they need it, except when it's an issue of high personal interest to them, and then they are likely to ask for information and advising state health departments to actually be ready, anticipate what that's going to be and be ready, and the strategies that Marla was talking about are excellent for identifying what those are.
And I want to share one more thing. We need not think that it's scary to talk to our legislators or our representatives. They are there for us. We elect them. I'm spending a lot of time these days teaching my 12-year-old daughter that she has a voice. She goes to county council members. She brings her friends. It's not a scary thing. They want to hear from their constituency, and it's really important that we all remember that and be part of our own community circles and take that fear away.
Thank you so much. So we will now move on to our break. I'm sorry? You have a question. I'm sorry. Go ahead.
No, that's okay. Leah Wiggum here with the Obesity Society. One thing I see to your point that you just made, in the circles that I work in, I deal with a lot of people who are state employees and federal employees. And we may be the experts in the scientific area, but we get a lot of pressure through our institutions to not speak to elected officials. And so I think the more we can do, and if you have any comment on how to go about this, that would be great. The more we can do to empower our scientific community in academia and the scientists working in government to know how to go about making sure those elected officials have the best evidence presented to them without getting ourselves caught in trouble with accusations of lobbying, or just, I'll get pressure just to say, oh, you can't go do that. That's not okay for you to talk to that person. You have to go through these, 5 hoops and get approval, and all of us are busy with research and teaching and all those responsibilities. So it becomes overwhelming, and it becomes much less likely that we want to be communicating with those elected officials at all those different levels, whether it's city, county, state, or federal. So if you have any suggestions on how we can create a better communication environment, that would be great.
Well, thank you for raising that point, because we did hear about that a lot as well. The states and that we talked to were all over the page with how easy it was, sometimes going through 15 levels of bureaucracy to answer a question versus being able to walk across the street when they got a phone call. And what the public health advocates who were not in state government that we talked to made the point that, we can talk about things that the state health department can't. They have the data. We can get that information from them. But that was a strategy that was was pointed to as one way to help in communicating the issues related to healthy eating, active living, where there are some limitations on a state health agency that other groups do not have. So.
Yeah, and I'm going to add the multiple hat scenario that I often do at AHA as well, because I am not, my role, I'm not doing any lobbying according to our grants. So I put on my hat for AHA, I take off my hat as a personal, individual community citizen that raises an issue of concern and then points my legislator to where they can go and find the data or information. And then if the request comes from them to your agency, then you can respond, for instance, as an example.
Thank you. We are out of time, but we'll make you the first.
It's not a question.
Oh, it's a comment.
Yeah, so you mentioned the business and how legislators listen to business. And so I just wanted to put in a plug on Wednesday. The Business Engagement and Obesity Solutions Innovation Collaborative is partnering, having a forum here in this building. Leslie, I don't know where. Room 120, thank you. From 8:30 to 3, and so it's much like this workshop with panels, but really targeting how do we communicate with businesses and how do we get businesses engaged in community health improvement, and obesity, one of those.
Thank you. Thank you to all of our speakers for this session. We will reconvene in 15 minutes with all of our speakers for a continued discussion.